All right, Scott, you are all set now. Sorry about that.
Perfect. All right. Well, welcome everybody. Welcome to IMC's third webinar of the year. So if you've been to the first two already, welcome back. If this is your first, like I said, welcome. My name is Scott Eiselt. I serve as the VP of Clinical Operations for IMC. I'll be your speaker today. IMC stands for those of you who are not aware, Integrated Musculoskeletal Care. We are a musculoskeletal care delivery company. We provide care for everything from joint pain, neck pain, back pain, muscle injuries, tendon injuries, nerve problems. And we do so through what's called a response-based assessment process that helps us determine what is the appropriate level of care for a given individual, whether they can self-care or we need to get involved or they need to go see someone from a different discipline in order to get the outcome that they desire. So with that in mind, today we're going to go through elbow, wrist, foot, and ankle pain, kind of our smaller joints, and some various things that we can do to prevent problems at that level, as well as some just kind of high-level topics around musculoskeletal care and general musculoskeletal health. And so without further ado, we'll jump right in. So we're talking about some facts about joint pain here in a moment. Like I said, we're going to touch on things that contribute to our joint health, things that we can do that will help keep us healthy, and what to do if we sense a problem is occurring. So we'll jump into some of those. And then if we do indeed need care, how to access different care points, at least through our model, as far as some self-care opportunities, as well as care with a clinician if needed. So if you were in the first couple, we touched on this topic last time when we talked about the shoulder, but I wanted to bring it back up as part of some consideration for today's topic. So these numbers on the screen on the right, we're going to talk about elbow, wrist, and ankle and foot pain. All right. There was a study done that I referenced last time, but I'll bring it up again, that they looked at those that had standalone peripheral joint pain. So this could be in the elbow, in the forearm, in the wrist, in the ankle, or in the foot. And they also did hip and knee, but since that's not specific to today's topic, I won't necessarily highlight those. And they were trying to identify how many of those individuals had the problem as the source being somewhere other than the joint itself. And through a reliable assessment process, they moved the spine and they were able to identify that in 44% of elbows, 38% of wrists, and 29% of ankles and feet, that those particular people, their problem was seemingly sourced or coming from the spine that's associated with that extremity. So for instance, in the elbow and wrist, it would come from the neck. And they determined that through repeated movements of the neck, and they're able to fully resolve the person's condition by only moving the spine and not addressing anything at the level of the joint. All right. And so why is that important? Well, as we start talking about elbow, wrist, and ankle prevention and health, we can't do so without recognizing the role other parts of our body play in the health of those joints. And so if, let's say, 38% of wrists are potentially originating from the neck, we've got to make sure that we're also then addressing the health of our neck in order to reduce our risk of wrist problems across the board. All right, so I want to make sure that we all understood the value of that, and we'll go through some spine-specific movements later on in the presentation. Okay. The other point I want to bring up about is that when you're talking about musculoskeletal problems, over 90% of them are mechanical in nature. What that means, they're affected, maybe caused by movement-based activities, but then they also need movement-based approach or care in order to resolve the condition. All right. And so what does movement-based mean? That's in the form of either stretching or exercise or postures or positions, or maybe even a clinician needing to move you or demonstrate movement to you. So, and where that leaves is about 10% of problems, which would fall in more they need surgical intervention, inflammatory problems that need chemical intervention like injections or medicine, or other types of problems that might be more systemic or some other source other than a mechanical issue. All right. So when you start thinking about why am I hurting, right? More times than not, that's because it's a movement-based issue in the joint itself or from something that controls that joint. And we'll get into some of those specifics. Those mechanical problems, all right, between 67 and 92% of all joint problems, whether that be the neck, the low back, the wrist, the elbow, the shoulder, the ankle, or the foot, they're capable of changing rapidly. Okay, what does rapid mean? Rapid means that you can create cause and effect change by moving that problem in the moment. And then typically with the right strategies performed, you can see significant upward improvement to like 80% or more in a matter of 2 weeks. Okay, so then you're talking about resolution of a problem in days to weeks versus, say, some other types of injuries that require healing time and some of those things which are weeks to months in nature. All right, so rapidly changeable problems can also be prevented at a high rate. And so we're going to get into we're going to kind of focus on that as well today. All right, so that's commonly not understood is that you can change something that fast. But knowing how to identify those problems is what IMC is kind of built upon. And lastly, I put this in the last couple of webinars, but I keep it up there because it's such a hot button topic, is that you can't watch TV without seeing an ad about an anti-inflammatory, either medicine or hearing a friend tell you about how they got an injection and it worked great, and someone else got an injection and it lasted for 2 days and didn't work at all. These varied responses from anti-inflammatory treatments are due to the fact that less than 5% of our issues are actually created by inflammation. It's not to say inflammation isn't in the picture. It's just that it's not the root cause. So when you hear such a varied response from medicines or injections, it's because we might not be treating the cause, rather a symptom. And that would be why the problem continues to manifest itself after the treatment. All right, so some things that contribute to our joint health. All right, the top of the heap here, an active lifestyle. All right, this can be in the form of just regular exercise that could be light, moderate, or strenuous. Okay, using our structures, our joints, our muscles, our tendons, our ligaments, they then keep those structures with a certain level of vitality. All right, and they trigger the body to support those systems. So this use is actually correlated with the breakdown of those tissues. Okay, so using our structures, we will not wear out, rather we'll rust out. Okay, so use of our joints is going to help keep them healthy. Maintaining range of motion and flexibility. So making sure that we keep full range of motion in our different joints, using them to their fullest extent. And we're going to go through some stretches that target certain movements that we don't do probably enough that help keep our joints healthy. We'll do that later. And specifically moving the joints to end range, the third bullet point there, helps us maintain full and impairment-free range of motion within the joint. Okay. And also by doing that can help us recognize that a joint is all of a sudden starting not to work properly. So if we are frequently moving our joints to their limits and using them the way that we want to in their fullest extent, and then one day we're unable to do that and we can recognize that, it lets us then realize, hey, we need to address that. So that doesn't become an impairment or start becoming a domino effect, if you will, or create downstream issues. Strength and conditioning surrounding muscles and soft tissues. Okay, so regular use, which I was getting at earlier with our joints, and loading and stressing our structures is how the body stimulates a strong and durable structure. All right, so that you're less likely then to be exposed to injury when you're exposing your body to stress and strain, whether it be doing yard work or other types of activity. Repetition and prolonged positions contribute to joint health in that we do them often. Our lives are very repetitive. And so learning ways to interrupt those positions or how to better position yourself if you are going to have to remain in one position for a long time, for instance, sitting. And then if you do interrupt, what movements are going to be most effective at interrupting a position to help keep the joint working and operating normal. All right, and last but not least, address painful impairments. Our body is extremely good at fixing itself. All right, it's very good at healing and restoring functionality and maintaining it. But sometimes something can occur, whether that be a seminal moment where we had an injury or something over time, the cumulative effects of how we move or don't move create a problem. But once we recognize we have a problem and you allow for, let's say, enough time for your body to correct itself, and you're noticing it's not correcting itself, it's important that you address that. And not addressing it is likely they're going to start, your body will create adaptations and you'll start then functioning with this impairment. That gets harder to unwind the longer that we do that. Okay, so address the problem when we recognize it. All right, I'm going to, instead of giving you very specific diagnoses, what's important to do when you're talking about musculoskeletal health and problem solving is to put musculoskeletal issues into subgroups. Okay, so what they found by applying a specific diagnosis to somebody, that doesn't always lend to a specific treatment. Instead, if we have, let's say, a subgroup, okay, those that are in this particular group, this type of treatment or approach is often then going to be needed to address it. An example that's not related to musculoskeletal health would be if we took everyone who had chest pain and we applied nitroglycerin, which is a treatment for someone who's potentially having a heart attack, to them. That might help some of them if they're truly having a heart attack, but not every chest pain person is having a cardiac problem. Some of them might have a musculoskeletal problem. Some of them could have indigestion. There's all sorts of reasons why we can have chest pain. So when we're talking about joint pain, there are a variety of different subgroups that can then lend us to having joint pain. Okay, so one of those is the spinal origin group, like I touched on earlier. So if you're having a wrist pain or elbow pain, that problem could originate from your neck. All right, and so then understanding how do we then target that with certain exercises. It could originate within the joint itself, and it could be rapidly changeable. You could have a muscle or tendon injury around that joint or a ligamentous problem. All right, a soft tissue problem that needs either stretching or strength and conditioning. And last but not least, you could have a structural issue that's come up that has arisen. All right, maybe there's a tear within a joint or a bone spur, or maybe something like a cyst has grown in there or something like that we can't change with movement. Or there is an inflammatory piece that needs some other treatment. So these are the different subgroups that may contribute to someone having elbow pain, wrist pain, or ankle pain. Okay. Now, from a preventative perspective, how do we attack those? All right. So from a spinal origin perspective, we touched on these with the neck last webinar, and I've got a slide for you all, but learning posture correction tools. All right. How do we make sure we position our spine in a way that removes the stress and strain from it, lowers the risk of an issue? Targeted end range movement. So moving our spinal segments into directions that can either correct problems, identify problems, or prevent them from starting because we need to move in these ways. Within the joint, same thing. So a rapidly changeable joint problem is typically as a result of not getting certain movements put through the joint on a regular basis, or we lose normal joint mechanics and we need to move the joint to correct them. Okay, so we've got a couple of things that we can do there for both the elbow and wrist as well as then the ankle. And then lastly, our soft tissue problems. Okay, so our muscle strains or tendon strains, things of that nature. So muscles and tendons are the elements that move our joints. They help us lift things, they help us move our body. And they then, to remain healthy, need us to strengthen and condition them and use them. Okay, so we actually have to apply stress on them. So a regular occurring or a frequent strength and conditioning program, whether it be to your hand and wrist muscles or your gripping muscles for your elbow, your feet muscles or your Achilles, of a general strength and conditioning program. I didn't include those in this presentation as far as specific exercises because there's so many different ways to strengthen a muscle. And so if you're doing it on a regular basis, All right, that becomes preventative and it helps keep those structures healthy. Okay, the movements I'm going to target in our preventative strategies today are the ones that can change rapidly. Okay, these are the problems that, number one, they're the most prevalent, so 67 to 92% of problems, depending on the joint, and they can change the fastest. So preventative movement strategies are going to have the most impact on them. All right, but I don't want to ignore the fact that muscles and tendons, and they can still have issues, and it's important that they get a little bit of attention as well. All right, so for the first one, which we touched on a second ago, is spinal prevention, right? So where this has the most impact is if you sit or look down throughout the day. So if you're sitting, your low back often gets rounded forward, okay, which then causes your mid back and upper back to hunch down and forward as well. And then our head is kind of down or forward, okay? This is the opposite of the way our spine was formed, okay? So if you look at the middle person, where there's an arch in the lower back, but just by arching your lower back while you sit, that causes all of the upstream effects that we need. So the torso is straightened up, the shoulders come back, and the neck and head are sitting over the top of the shoulders. Okay, so the posture correction should occur at your lower back, which will then cause an upstream effect to the levels above it in your neck, shoulders, and upper back. All right. Now, it's difficult to maintain that position unsupported. So if you are in a sitting environment, using some type of lumbar support, either built into the chair or external to the chair, to help support your back into that arch so that you're not having to actively maintain it. That passive level support is there to keep you in that position. Okay. Now, if you're standing and you're having to look down for work or bend over for work, that's where then there's some movements I'm gonna show you here that you're gonna have to interrupt those positions because just changing your posture isn't gonna be enough. Okay, so the first one here over on the left. Okay, so if we remember, anywhere from 30 to 45% of elbow and wrist problems can occur because of our neck. Okay, so I'm gonna show you guys the video on the left. Was that neck movement from 2 months ago that can help prevent issues from then occurring in your neck and then therefore affecting the upper extremity. All right, so the movement is repetitively looking up and backwards. You don't have to hold it, but just making sure you're capable of going there over and over again. Okay, it's recommended we do this in sets of 8 to 10. Once or twice a day would be a wonderful thing, so you recognize what normal is and keep the mobility within those joints. Okay. The second one then for the wrist I put in here. All right, so we talk about rapidly changeable problems within the joint. We often are because we don't take the joints to their limit. Okay, so the way you do the wrist one is you're going to put your hand on a surface. It could be your desk, a chair, countertop like this person is. You brace your hand with the other hand to hold it in position. Okay, and then you're going to kind of lean over it, forcing the wrist into a backward bent position to its limit or to its end range. Oh, keeps doing that, sorry. All right. And by doing that and applying that end range stress to the joint, you're going to maintain healthy movement throughout the joint. Okay. If you go to do that and it's in any of these joint ailments, if you're limited in mobility, you should attempt to repeat it. Okay. If it's the correct movement, it should get better and better the more you do. If you need some other intervention or you need to be assessed more thoroughly by a clinician like myself or one of my colleagues, it could remain the same or potentially could aggravate it. And at that point, you should stop because these are meant for prevention, not treatment, and then seek care in order to identify what is the best strategy for you in order to get better. Okay. I got 2 elbow movements I'm going to show you. One is kind of a starter move, and then depending on the response, if it feels good, I'll show you the second one. So the first one is you'd support your elbow from underneath, and you're gonna straighten the elbow as far as it can using your muscles. All right. Some people might call it hyperextending, but it's really just straightening the elbow as far as you can go into its full straightening direction. All right. We live in an elbow bent environment. And so oftentimes fully straightening that elbow can keep it from becoming stiff and painful. A lack of full range of motion in this direction actually contributes commonly like to tennis elbow or golfer's elbow, if you've ever had that or been told you have it. And so the joint itself can actually get stiff and start malfunctioning. And then that causes the muscles and tendons that control your grip and your elbow to become very painful. Okay, so this is a common preventative strategy for that condition. And here's the other one where you push the elbow straight while it's supported on a surface. And now last but not least, we're going to dive into the foot and ankle. So according to that study, at least, and I can say anecdotally, there's definitely these that occur. Local foot pain, it could be heel pain, could be plantar fasciitis, it could be Achilles pain. It seems like a tendon issue. Any of those and all of them have the possibility of coming from the nerves in our lower back. If our lower back gets stiff, then it sends that signal that there's an issue wherever that nerve goes. Well, if that's what control your foot, your brain thinks you have a foot problem. Okay. So in another webinar later this year, we're going to dive into the low back more thoroughly, but this is the movement that you can perform in order to troubleshoot that or prevent low back issues, and give you a little precursor. All right, so you press yourself up and bend backwards and then lower yourself back down. Again, it's very repetitive in nature. It's the opposite of the position we find ourselves sitting in or bending forward most of the day. And then the alternative is bending backwards over a surface, typically a countertop. Again, reversing the effects of all of our bending and sitting throughout the day. All right. All right. So seeing it isn't the majority of foot and ankle problems coming from the back, the foot and ankle also requires some level of movement and stress. Okay. And so this maneuver, where you force the foot and ankle to stretch in this direction, can help with the correction of plantar fascial pain, ankle pain, if it's coming from a rapidly changeable condition, but can also keep those structures, like I said earlier, kind of used to stress and strain and healthy because they've been taken to their limit on a regular basis. All right. There's that one. Now, I know these were very rapid, and it's kind of, like I said, a robust topic this time. In a moment, we're going to give you access to our web application. And in here, there's a suite of preventative videos. So if you want to watch these on loop or receive more information about them, you will have access to those. So it's not like there's a one-time 2 repetition video to give you the background. So there will be more that you can then sink your teeth into. All right, so some kind of high points here. Putting yourself through a daily movement assessment, okay, knowing what your joints are capable of so you can recognize when something doesn't feel normal, all right, is extremely important when it comes to preventing joint issues. Performing end range movement, like I just showed you, on a regular basis, and then attempting to address any stiffness can aid in the prevention of any of these problems. And in some cases, you need a self-care, right? So those are the specifics above and beyond what we talked about earlier. Okay. And like I said, these movements are meant for prevention. And in some cases, you can self-care with them. But if you find them aggravating or they don't correct an issue, you may have a different source of the problem or you need a different strategy. And that's where then a more robust assessment is in order. For that, you have a couple options. If your employer, which those that are on here likely, if your employer has our services as a benefit, all right, you may have in-person care, or in this year you get one-on-one treatment with one of our providers. You can then get a more robust assessment, identify what it is you would need to resolve your issue. Others that you'll have, like I'm going to give you in a minute, Joint Strong web application access. Okay. And there's a self-care application. So you can go in there and actually evaluate yourself using the tool that's embedded in the web app. and it will then give you feedback as to whether or not you're a good candidate for self-care or if you should seek care from a licensed clinician for your problem. Okay, so that's another option. And then the last option would be if you did need care, however, you don't have in-person clinics near you or as part of your benefit program, IMC has a virtual care network. All right, and so we provide our clinical services through telehealth. Right, and this is I would say it's not emerging anymore. It's a very common form of providing care like this, but it's becoming more and more well known, and the outcomes that we're finding are equal, if not advantageous, to in-person care. All right, it's very convenient as an option. The clinician meets you wherever you are, whether that be at home or in your office if it's appropriate there. All right, and more times than not, we don't necessarily need to put our hands on you, rather show you how to perform appropriate movement to correct your problem. All right, so I thought I'd put this in here this time in terms of comparison, because a lot of people are unsure or maybe feel as though you won't get adequate care from a virtual, or it's limited care, and that's just not the case. And then what we found is we've now compared all of our in-person clinic care to telehealth, and as you can see here, the results are equivalent, and in some metrics, and more beneficial from a telehealth perspective. So we find patients are equally satisfied, and they're getting the care that they need and seeking that and achieving the outcomes in order that they need as well. All right. So for those of you who are maybe unsure about the telehealth option, it might be worth giving it a try, given the outcomes that we can achieve. All right, kind of under the gun here time-wise. Here is, you guys can either write down this web app address, shoot the code as well, so app.jointstrong.com. And within there, you can find both that self-care evaluation if you do have a current issue, or if you just want more of that preventative information that I went through earlier. The videos are all embedded within the application. So I'll pause there. I know that was a lot to digest, but if anybody has any specific questions, or if there's anything that's within the chat, feel free to speak up. I can stay on the line here for a few minutes.
Hey, Scott, just looking through the chat, doesn't look like you have any questions so far in the chat.
Great. Well, for those of you who are kind of new to the webinar format, last few times we will send out, or we'll put the deck in the chat itself. So we'll make sure to do that. And then be on the lookout for the announcement. We're doing these webinars every other month. So hard to believe it's May, but we'll be doing another one of these in the latter half of July. But thank you for those that did attend. Have a wonderful rest of the week, and reach out if you have any questions or concerns.